All right, today we're jumping into a topic that's often called a silent killer, and for a very good reason. We are talking about arterial aneurysms. These are dangerous, often totally hidden bulges in the major pipelines that carry blood all through our bodies. And the scary part? They can grow for years without a single symptom, until it's way too late.
So, here's how we're going to break it all down. We'll kick things off with the absolute basics. What even is an aneurysm? Then, we'll get into the main culprits, the abdominal and thoracic aortic aneurysms. After that, we'll look at some other types you might find, clear up the super important difference between an aneurysm and a dissection, and finally, we'll wrap it all up with the key takeaways you really need to remember.
Okay, first things first. Before we go any further, let's build a really solid foundation. We need to define exactly what an aneurysm is and get into the basic physics that make these things so incredibly dangerous. So, at its core, the definition is pretty straightforward, but every word matters. An aneurysm isn't just a minor swelling. We're talking about a permanent, localized bulge where an artery has expanded to at least 1.5 times its normal size. Seriously, just picture a weak spot on an old tire that's starting to balloon outwards. It's the same idea, but inside your body.
Now, this is where it gets really crazy. Why do these things get progressively worse? Well, it all comes down to physics, specifically the law of Laplace. The formula is simple. Wall tension equals pressure times the radius. This sets up a terrifying feedback loop. As the artery's radius gets bigger, the tension on its wall goes up. And what does that do? It causes the wall to stretch and dilate even more. It's this vicious, self-perpetuating cycle that just gets worse and worse.
It's also super important to know that not all of these bulges are the same. A true aneurysm is when all 3 layers of the artery wall, the intima, media, and adventitia, are involved in that ballooning. But a false aneurysm or a pseudoaneurysm is a whole different beast. It's more like a leak, a hole in the artery that gets plugged up by the surrounding tissue, forming a contained pocket of blood outside the vessel.
And you'll typically see them in 2 main shapes. The fusiform ones are spindle-shaped. They affect the whole circumference of the artery, and these are super common in the abdominal aorta. Then you have saccular, or berry aneurysms. These are little spherical pouches that just stick out from one side, and you find these classically in the arteries of the brain. Okay, now that we've got the fundamentals down, let's really zero in on the big one, the most common type you'll hear about, the Abdominal Aortic Aneurysm, or AAA for short. So what is actually going on at the microscopic level to cause this? Well, the key villains here are these enzymes called matrix metalloproteases, or MMPs. When you have chronic inflammation, these MMPs get released, and they basically act like tiny molecular scissors, just snipping away and breaking down the elastin and collagen that give the aortic wall all its strengths and flexibility. As that happens, the wall gets weaker, and that's when it starts to bulge.
All right, quick question for you. Think about it. Of all the things you can change in your lifestyle, what do you think is the single biggest risk factor for getting an atrial?
Yep, it's smoking. And it's not even a close race. For current smokers, the risk is a staggering 7 times higher. So, the biggest takeaway here is that quitting smoking is, without a doubt, the most powerful thing someone can do to lower their risk.
Now, when an AAA that's been growing silently for years finally ruptures, it is a massive medical emergency. The classic signs are what we call the rupture triad. First, the sudden tearing pain in the abdomen or back. Second, you might actually feel a pulsating mass in the belly. And third, a sudden catastrophic drop in blood pressure, which leads to shock.
So when do doctors step in? Well, the risk of it bursting goes up dramatically with its size. And this number, 5.5 centimeters, that's pretty much the magic number. Once an AAA gets bigger than that, the risk of rupture usually outweighs the risk of surgery. So that's when repair is typically recommended. Okay, let's move on up from the abdomen into the chest and talk about the AA's less common but often more dangerous cousin, the Thoracic Aortic Aneurysm, or TAA. While high blood pressure and atherosclerosis are common causes, TAAs have a really strong link to certain genetic disorders. You've got Marfan syndrome, which is a defect in a protein called fibrillin-1, and Ehlers-Danlos syndrome, a defect in collagen. Both of these basically lead to faulty connective tissue in the aorta. And a really classic old-school cause is tertiary syphilis, which can create this tree bark look on the inside of the aorta. Because a TAA is in the crowded space of your chest, its symptoms are all about what it's squishing. As it expands, it can press on things. If it presses on the recurrent laryngeal nerve, it can cause hoarseness. That's called Ortner's syndrome. If it pushes on the esophagus, you can get dysphagia, which is difficulty swallowing. And if it stretches out the base of the aorta, It can make the aortic valve leaky, leading to a heart murmur. Now, the aorta isn't the only place these things can pop up. Let's take a quick look at aneurysms that form in some of the other arteries in the body.
So, the most common peripheral aneurysm is found in the popliteal artery, which is right behind your knee. And here is the absolutely critical thing to remember. About half of the people who have one of these also have an AAA. That means if you find an aneurysm behind the knee, you have to check the abdomen with an ultrasound. No exceptions.
But here is the key difference, and this is a big one. For aortic aneurysms, the number one fear is rupture. For a popliteal aneurysm behind the knee, the biggest danger is actually a blood clot. That turbulent flow can form clots that break off, travel down to the foot, and block off all circulation. We sometimes call this trash foot, and it's a limb-threatening emergency.
Okay, before we wrap this all up, we have to clear up one of the most common points of confusion out there. We need to talk about the difference between an aneurysm and an aortic dissection. They sound similar, but they are absolutely not the same thing.
This table lays it out perfectly. An aneurysm is a dilation. The entire vessel wall balloons out. A dissection, on the other hand, is a tear in the inner layer, the intima. This tear lets blood tunnel its way between the layers of the artery wall. The pain is totally different too. Aneurysms are often silent for years, while a dissection causes a sudden, tearing, or ripping pain. And finally, the urgency. Aneurysm repair is often a planned, elective surgery. A dissection is a life-or-death, immediate surgical emergency.
All right, let's bring it all home. We've covered a lot of ground, so let's distill it down to the most important, high-yield takeaways from our discussion.
So, to recap, if you remember nothing else, remember this. Aneurysms are dangerous in three main ways. Number one, and the most catastrophic, is rupture, which leads to massive internal bleeding. Number two is thromboembolism. That's when clots form and then travel downstream, blocking off blood flow. And number three is compression, where the aneurysm just gets so big it starts to squish the organs and nerves around it.
And that wraps up our deep dive into arterial aneurysms. If you really want to make sure you've got this stuff down cold, head over to our website. The link is right there in the description below. We've put together some awesome high-yield notes, a mind map for a super quick review, and a practice quiz so you can test yourself. Thanks so much for joining me.